Hey, it's Dr. Dunaway here with Chiro Strength, and this video is the first in a three-part series for the knee pain blog. And today's video is going to be about assessing and some tips for the foot and ankle. And what we're going to start with is big toe extension. And why big toe extension is so important with knee issues is because in gait, if we don't have big toe extension, we're going to really compensate and the knee's going to suffer for that. So if I walk forward and I have good big toe extension, I'm going to come right over my big toe and just keep the knee and hip in line like this. If I don't have that big toe extension, I tend to let this foot come out so I can walk forward, but as I do that, I don't need as much extension here, but my my arch will collapse and my knee caves in like this, and so as I start walking, my knee's gonna take a lot of pressure on there. So a real simple exercise for that is just this easy rocking drill. Putting my toes in the ground like this, what I'm gonna do is slowly rock back and come back and forth, opening up the bottom of the feet, making sure I'm not pushing too hard, but getting as far and deep as I can, eventually trying to get to the point where I can kind of put a little pressure here, really work that big toe into extension. So if that hurts you, you can simply come up to a door frame or something like that, put the foot up into it, and just kind of lean in like that. And both of those work fine. So the other thing we talk about is foot stability, and a really easy assessment for that that you can do on your own is just a calf raise. And now what we usually see with calf raises with a foot and ankle that's unstable is as you come up, you tend to see the weight kind of shift out to the little toes like this, and you kind of see these heels come apart. And as you do that, you can see this Achilles tendon, how it's bowed. And so every time we take a step, if we're not coming over that big toe and we're kind of flailing out to the side, we're going to get a lot of poor tracking of the foot and ankle, which is going to affect the knee a whole bunch. So again, a really easy drill for that is I'm going to do some real slow calf raises. I'm going to use a stick right here for some support. But what I do is slowly lower down. And then as I come up, I want to think about the big toe knuckle right here. And I want to think about keeping pressure on that big toe knuckle. So whether you put a quarter down and you think about putting pressure on that quarter, or if you just think about keeping pressure on these big toe knuckles, I want that heel to track nice and straight up and down. Slow, slow, eccentric. Another good tip to do is maybe put a tennis ball or something in between your heels and keep that tennis ball squeezed as you go up and down. But what we're looking for is that tracking up and down like that. Those two things, I know it seems simple, but done on a regular basis to increase the toe extension and also trying to get the tracking of the Achilles tendon proper with strengthening that intrinsic foot muscles with those simple, slow, eccentric calf raises can go a long way with improving the environment that the knee is in. And so any treatment you get on top of that will just last longer and be more effective. So stay tuned to the other videos. If you haven't read the blog, I'll have a link in the description below to go to the full blog. And this is Dr. Dunaway with Chiro Strength saying, don't just mend, transcend. Thanks.